So, you clicked on this video. Either you're incredibly curious, aggressively anxious, or you're 35 and just want to see if my experience was as disastrous as yours. Welcome. Today we are talking about your first time. If you watch movies, you probably think losing your virginity involves a perfectly lit room, a Marvin Gaye soundtrack materializing out of thin air, and a seamless choreography of limbs that concludes with both of you staring deeply into each other's eyes while the camera slowly pans to an open window. I am here to tell you that is a lie, a massive cinematic lie. Hollywood has set you up for failure, and honestly, someone needs to step in and manage your expectations before you pull a hamstring. So here is the brutally honest, entirely unsolicited advice about what actually happens during your first time. Let's start with the most controversial piece of the puzzle, the person you choose to do this with. I know modern ideals about having sex have changed wildly. If we look at the generational timeline, it is quite the roller coaster. Growing up, my grandmother made it very clear that if I got pregnant before getting married, she would disown me. Not just ground me, disown me, change her name, move to Florida, and pretend I was a hallucination. Then came my mom. Her generation softened up a bit. Her advice was simply to make sure it's the right person, honey. Which is vague but well-intentioned. But these days, it's completely different. Modern parents are absolutely terrified to talk about anything with definitive rules. They don't want to step on toes. They don't want to enforce outdated societal norms. So they just sort of hand out a participation trophy for puberty and hope you figure it out on the internet. Well, parents are scared, so let me be the baddie on this one. You need to actually like the person you are sleeping with. I know, groundbreaking advice, but I don't just mean you think they have a nice jawline or a cool car. I mean, you need to trust them enough to be overwhelmingly vulnerable. And more importantly, overwhelmingly awkward. Your first time is not going to be smooth. It is going to involve weird noises, confusing angles, and probably an elbow to the ribs. If you do not feel comfortable enough with this person to laugh when you inevitably headbutt each other trying to take off a shirt, you should not be seeing them naked. Period. Wait for someone who treats you with basic human decency and won't make you feel stupid when you don't know what you're doing. Because, spoiler alert, neither of you know what you're doing. Moving on to the unsexy reality of biology, hygiene. We are going to have a very serious talk about soap right now. Take a shower, brush your teeth, floss, scrape your tongue. I don't care how in the moment you feel. If your breath smells like an everything bagel with extra onion, the moment is dead. It is buried. Do not resurrect it. Make yourself smell nice. And I don't mean spraying half a bottle of cheap cologne or perfume over your unwashed body to mask the scent of nervous sweating. Take a proper shower. Get into the crevices. If you want a pro tip, I highly recommend the L'Occitane Almond Shower Oil. It smells absolutely divine, like you naturally secrete wealth and toasted almonds. It makes your skin ridiculously soft, and it lingers just enough without suffocating the room. But looking past the aesthetic of smelling good, hygiene is quite literally a medical necessity. Taking a shower and cleaning yourselves properly beforehand and absolutely washing up afterward helps prevent infection. Urinary tract infections are real. Bacterial infections are real, and let me tell you, nothing ruins the romantic afterglow of your first time quite like sitting in a brightly lit urgent care waiting room at 2 a.m. because it burns when you pee. Wash your hands, wash your bodies, empty your bladder afterward. Be an adult about your bacteria. Now, let's talk about the absolute non-negotiable rule of the evening. Protection. I do not want to hear excuses. I don't want to hear it ruins the mood. I don't want to hear it doesn't feel as good. You know what really ruins the mood? 18 years of financial responsibility. You know what doesn't feel good? A frantic Google search of early pregnancy symptoms at 3 in the morning, or realizing you need a round of antibiotics for something you caught because you were too embarrassed to go to the pharmacy. Protection is a must. If someone tries to pressure you into skipping the condom or whatever barrier method is appropriate for you, put your clothes back on and leave. I am dead serious. If they do not respect your physical health and safety, they do not deserve access to your body. End of discussion. And yes, putting a condom on for the first time is awkward. It feels like you are trying to put a winter sock on a slippery banana while someone watches you. It's fine. Laugh about it. Practice beforehand if you have to. Just use it. All right, let's get into the mechanics. Specifically, foreplay. There is this bizarre misconception that foreplay is just the trailer before the main movie. It's not. Foreplay is the first act, the second act, and honestly, sometimes it is the best part of the entire franchise. Take it slow, agonizingly slow. The human body is covered in millions of nerve endings, and for some reason, nervous beginners tend to completely ignore 99% of them. Your partner is a whole person. Do not treat them like a video game controller where you just aggressively mash the A button hoping to unlock a secret level. Start with the absolute basics. Kissing, touching their arms, their shoulders, the back of their neck. Gentle touches. And speaking of touching, let's talk about the transition phase. Removing clothes. You are not defusing a bomb. If you cannot unhook a bra with one hand in the dark like James Bond used two hands, it is fine. Nobody is timing you. If your partner gets stuck pulling a tight sweater over their head, help them out. Don't just sit there watching them aggressively flail around on the bed like a trapped ghost. Unstick them, laugh about it, and move on. During all of this, you need to actually use your words. I know, terrifying, but your partner is not a mind reader. If something feels good, say so. If something feels like they are aggressively kneading bread dough, gently redirect them. You don't have to sound like a flight attendant giving emergency exit instructions. A simple, I like that, or let's try this, or even just guiding their hand works wonders. And please ask, is this okay? Or does this feel good? I promise you, enthusiastically checking in is not going to ruin the mood. You know what ruins the mood? Suffering in silence for 12 minutes while someone aggressively rubs your hip bone because they missed the target. Sex is not a race. If you try to skip the warm-up and rush straight into the main event, you are going to experience friction and a profound sense of disappointment. Buy lube. Keep it on the nightstand. Use it. Now, a quick public service announcement about anatomy and what happens when the actual main event begins. For the women or anyone with a vagina, I am not going to sugarcoat this. Your first time might hurt. It is a muscle that hasn't necessarily stretched like this before. It might sting, there might be tearing, and there is a very real chance you will bleed. This is completely normal. But because of this, please do yourselves a massive favor and put an old dark towel down on the bed, or at least an old sheet. Do not sacrifice your mother's expensive white Egyptian cotton sheets to the altar of your virginity. You will never get that stain out, and explaining it to her while holding a bottle of bleach is a conversation you do not want to have. And for the men or whoever is initiating, listen to me very carefully. Be considerate. If your partner says ouch or wait or stop, you stop immediately. You do not negotiate. You do not ask for just 2 more minutes. You do not audibly sigh like you've been inconvenienced at a drive-through. You pause, you check in, and you adjust. If you ignore her pain because you're having a good time, you are not a romantic partner. You are a liability. Be patient, take it back a step, and for the love of everything, refer back to the lube we just talked about. Finally, and this is the overarching theme of the evening, do not expect it to be perfect. Your first time is going to be messy. It's going to be clumsy. Someone is going to get a cramp in their calf. Someone's hair is going to get pulled. You will probably try a position you saw on the internet, realize you lack the core strength to maintain it, and gracefully collapse onto the mattress like a dying fish. That is normal. That is exactly what is supposed to happen. It's just two humans trying to figure out how their bodies fit together, usually in the dark, usually while worrying about whether the door is locked. If you go into it expecting a flawless cinematic masterpiece, you will be deeply disappointed. If you go into it expecting a slightly goofy, highly educational, and entirely human experience with someone you genuinely care about, you'll be just fine. It gets better with practice, I promise. If you found this helpful, or if I just validated your own disastrous first time, hit the like button. Subscribe if you want more unfiltered truths, and let me know in the comments if your grandmother also threatened to exile you to another dimension. Stay safe, wash your hands, and I'll see you in the next one.